Welcome. Today, we're diving into a relatively rare and complex condition that affects both hearing and vision: auditory nerve hypoplasia, often associated with ocular manifestations. Join us as we unravel the intricacies of this disorder, exploring its causes, effects, and available management strategies. The exact etiology of auditory nerve hypoplasia is not fully understood, but it is believed to be multifactorial, involving a combination of genetic and environmental influences. Some cases are linked to mutations in specific genes involved in auditory nerve development. Other potential contributing factors include prenatal infections, exposure to certain toxins during pregnancy and premature birth. It's important to understand that in many instances, the specific cause remains unknown. Pathophysiologically, auditory nerve hypoplasia involves the underdevelopment or absence of the auditory nerve, the crucial pathway that transmits sound information from the inner ear to the brain. This disruption in neural signaling leads to varying degrees of hearing loss. Additionally, when coupled with ocular manifestations, it can involve abnormalities in optic nerve development, retinal function, or other visual structures, further impacting the processing of visual information. Auditory nerve hypoplasia is considered a rare condition, making it challenging to determine its precise prevalence in the general population. Due to its association with various genetic syndromes and other developmental disorders, the reported incidence varies considerably. Ongoing research is crucial to gaining a more accurate understanding of its epidemiology and distribution across different populations. The signs and symptoms of auditory nerve hypoplasia can vary widely depending on the severity of the nerve underdevelopment and the presence of associated ocular issues. Common auditory symptoms include varying degrees of hearing loss, ranging from mild to profound, and difficulties in speech development. Ocular symptoms can encompass reduced visual acuity, nystagmus, involuntary eye movements, optic nerve abnormalities, and retinal defects. These combined sensory deficits can significantly impact a child's overall development and quality of life. Diagnosis of auditory nerve hypoplasia typically involves a comprehensive audiological evaluation, including auditory brainstem response (ABR) testing to assess the function of the auditory nerve. Magnetic resonance imaging (MRI) of the brain can help visualize the size and structure of the auditory nerve. A thorough ophthalmological examination, including visual acuity testing, fundoscopy, and electroretinography at ERG, is crucial to assess any associated ocular abnormalities. Genetic testing may be considered to identify potential underlying genetic causes. While auditory nerve hypoplasia is a distinct condition, its severity and presentation can vary. We can broadly categorize cases based on the degree of hearing loss, ranging from mild to profound. Furthermore, the presence and type of ocular abnormalities influence the specific subtype. For example, some individuals may have severe hearing loss with optic nerve hypoplasia, while others may experience moderate hearing loss with retinal abnormalities. These classifications are important in guiding the treatment and management approach. Currently, there is no cure for auditory nerve hypoplasia. Treatment focuses on maximizing the individual's communication abilities and addressing any associated visual impairments. Hearing aids or cochlear implants may be beneficial for individuals with residual hearing. Early intervention programs, including speech therapy, language therapy, and auditory training, are crucial for language development and communication skills. Visual aids and therapies can help manage visual impairments. A multidisciplinary team of audiologists, ophthalmologists, therapists, and educators is essential to provide comprehensive care and support. As auditory nerve hypoplasia is primarily thought to arise from genetic and early developmental factors, specific preventative measures are currently limited. Genetic counseling may be beneficial for families with a history of the condition or related disorders, ensuring optimal prenatal care, avoiding exposure to toxins during pregnancy, and addressing premature birth complications can potentially reduce the risk. Although these factors are not always preventable, the prognosis for individuals with auditory nerve hypoplasia varies depending on the severity of the condition, the presence of associated ocular or other developmental issues, and the effectiveness of early intervention. Early diagnosis and management can significantly improve communication abilities and quality of life. Recent research focuses on identifying specific genetic mutations associated with auditory nerve hypoplasia and developing gene therapies to potentially restore auditory nerve function. Advances in cochlear implant technology and visual rehabilitation are also improving outcomes for affected individuals. Continued research is essential to improving our understanding of this complex condition and developing more effective treatments.